So just tell us a little bit more about what you're pushing for the government to do.
Well, with the new wave of Omicron, it's likely there'll be a lot more people having to take time off to self-isolate, time off sick. And the government previously had a rebate in place for small businesses that they could reclaim 2 weeks worth of sick pay for workers in that position. But that was withdrawn in September. So what we're pushing for today is the reinstatement of that rebate so that small businesses don't lose out if workers have to take time off sick, and some other measures to improve eligibility of sick pay. Because what you don't want in a situation like this is people at work being forced to have an invidious choice between trying to do the right thing for themselves and for others in terms of public health, or trying to put food on the table for their families. So it's really important that we get the best sick pay we can in operation in the coming weeks.
Can we afford it?
Yeah, this is not a high cost option. The costings put on this are around £50 million, to be honest, in what we've spent, in the context of what we've spent on the COVID epidemic in the last year. It's not a huge amount.
So Keir Starmer, the leader, of course, of the Labour Party, has said the Prime Minister has been asleep at the wheel since he's received the latest sage advice. The public want to know the government has got a grip, but tragically, Boris Johnson is so distracted by his own internal party pressures that he's unable to provide the leadership that this country needs. In terms of leadership and now, what would the Labour Party do?
What we'd do if we were in government is take this sage advice and make a decision on both public health and economic support. And it's really important that those two things go hand in hand. Look, it looks quite likely that over the coming days or the coming weeks, there'll be more measures announced. And what's important in this is what's the judgment government's going to make. Our fear is that after the rebellion in Parliament last week, the question in Boris Johnson's mind is not what's the right thing to do for public health here, but what can I get past my backbenchers? And that's not the best way to take major public health decisions. And even if his backbenchers
so let me just be clear then. Let me just be clear then. So you would support further lockdown restrictions?
Well, we haven't had those proposed. Nobody wants to see another lockdown, but we've got to do the right thing by public health. So our stance would be dictated by what's best for public health, what's best to save lives, what's best for the NHS. What wouldn't be in our minds is what's acceptable to a group of Tory backbenchers. It's really important that public health is the primary consideration in the Prime Minister's mind, not internal management of the Conservative Party.
You talk about public health, but then what about the public health of the people on hospital waiting lists? Because we've become the National COVID Protection Service. What about the people who will suffer as a result of their businesses perhaps being whether closed or shuttered or business turned away? What about the impact on international travel and trade because we're pretty much bringing the shutters down when we haven't got necessarily good data? It appears as if Keir Starmer and indeed the Labour Party want to see further restrictions as a result of the spread of Omicron.
Well, let me go through some of the things that you mentioned. In terms of business there, you're absolutely right to say that business is being hurt. But at the moment, there's a lack of reality in facing up to this. We had the Prime Minister on television a week ago saying that we were facing a tidal wave of restrictions. You then had the Chief Medical Officer a few nights ago saying people should deprioritise social contact, but you haven't had a new package of support for those businesses who at the moment are seeing their December profits disappear into thin air in many cases. So we're very clear that the economic support must match the reality of trading conditions for businesses and workers. That's really, really important. In terms of the NHS itself, look, we went into the pandemic with waiting lists that were getting longer, waiting times that were getting longer. We didn't go into the pandemic with an NHS that was fully fit to fight this, and that's because it had been underfunded for 10 years in the run-up to this. So it's really important in the future that we have an NHS that can both cope with crisis and those waiting lists that you're talking about. And the truth is, we didn't have that going into the pandemic because of the underfunding that had taken place over the past decade.
Okay, you talk about underfunding. Where's the money going to come from?
Well, the money for the NHS comes from, the same source as any other tax revenue. One of the things that's really important is we haven't had enough economic growth in the past 10 years. If you compare the rate of economic growth
But
from
Labour
when
wants
Labour
to
was in
raise
power,
tax. How's that going to improve economic growth?
you've told me Labour wants to raise tax. In what way?
But because every time, you just said, it comes from the normal means. If you want more money, you're going to have to raise tax, aren't you?
Well, the government has just imposed the highest tax burden since the 1950s.
Well,
and
if
the
you think
reason
that I
they're
or
having
indeed anybody else support that, think again. It's the worst way to develop the economy. But Labour has never been one for growing the economy by reducing taxation, has it?
Well, let's just compare the record. You say Labour's never been one to grow the economy. When we were in power, average growth rates were 2.3%. Since the Conservatives have been in power, the average growth rate's been 1.8%.
Well, with respect,
year on year,
it
that
was
makes a
partly
really big difference. So if you actually compare the economic growth rate that we had, including the financial crisis, by the way, to the economic growth rate over the past 10 years, you find quite a big difference. And that difference is enough to explain why the Tories are constantly imposing new tax increases on the economy.
Okay.
So part of the answer to this must be to get our economic growth up. And the Tories have
But
failed
isn't
to
part
do
of the
that
problem, though,
for the
when you
last
say
10
that
years.
when you say that more money is required for the NHS, isn't part of the problem that we have an allocation problem within the NHS? On the front page, for example, of every single newspaper, there is an advert with the NHS, get boosted now. So this is The Guardian, but it's on the front page of every single national newspaper. Is that a wise expenditure of taxpayers' money?
It's really good advice. I know that. And I would advise all your listeners, if they haven't had their, you call it booster, your third jab.
But isn't this what? Yeah, but fine. But it doesn't. You can say this. Other politicians can say this. The Prime Minister could come on for nothing to this programme and say that, and it would be far more effective than spending money. And look, I'm delighted that it's on the front page of the Times. That comes from the this very building downstairs. Thank you very much indeed, the government. Ka-ching, ka-ching. Giving us the money. Great. It's a waste of money. And until or unless politicians of all hues and colours understand that just tipping more money into the NHS is not the answer, we, the public, are going to get sick and tired of hearing this record. Why didn't you win that by-election? Because people don't trust Labour, just as they don't trust the Tories. It's hopeless.
Well, I hope you're not waiting for treatment when you say that funding the NHS is a waste of money. I don't believe
I'll go private. That's why.
I think, well, that you may have the funds to do that, but a lot of my constituents don't. So I think funding the NHS is not a waste of money. I think it's a good public policy.
You're right.
It's really
you're
important
right.
for the country.
You're right.
And I'm glad the country puts resources into it. And the truth is, if you look at health systems around the world, you've just said you want to go private.
Yes.
Where people have to pay to go private, there's huge inequities in treatment. I hope that the country doesn't take your advice to do that.
But hang on a second. But Pat,
with a publicly funded NHS system,
fine.
Because I don't think they are. The path that you're advocating would be
No.
equitable or indeed efficient.
Let me tell you, though, I absolutely support the concept of an NHS and healthcare which is free at the point of delivery. I think it's a brilliant concept. I think it's a brilliant idea. Sadly, politicians of all colours and hues have misunderstood how to deliver that effectively because their ideology has got in the way. And when people see millions of pounds spent on an advertising campaign like this, or indeed a bureaucracy or equality and diversity and all sorts of things which are taking place within our NHS, as opposed to spending money on frontline healthcare and making sure that, for example, nurses and doctors are paid more and paid more effectively and allowed to get on their job, rather than wasting money on, and Labour and Conservatives just as guilty, throwing billions of pounds into systems that don't work. Politicians are useless when it comes to allocating funds, and that's the problem.
Well, I got to go back to our record. If you look at when we were in office, our funding of the NHS, when we left office, we had the highest levels of satisfaction in the NHS recorded in any polls. We had waiting time significantly
having just
lower
bust
than
the economy.
We had a really good NHS.
Having just bust the economy, Pat. That's the problem.
Look,
you spent your way out of recession, spent your way back in again, caused a huge problem by committing the country to 30-year finance deals that were absolutely abominable. We're still paying the price now. We've never got value as taxpayers. Politicians should not be allowed to take financial decisions.
Politicians shouldn't be allowed to take financial decisions. I mean, politicians are elected to make the budgets for the country. In terms of the financial
Sadly,
crisis,
they're incompetent.
which you refer, I have to remind you, it was a global financial crisis. There is evidence of financial crisis in some other countries at that time. Of course, we were affected. We've got a big financial sector, but so were many other countries around the world. Our record in the NHS was very good. And if you compare it to what's happened since, you end up, as I say, with those longer waiting times and an NHS that wasn't fully equipped and ready for the pandemic because of 10 years of underfunding in the run up to this point. That's not a good way to run the NHS. We need to make sure it's stronger in the future.
Well, certainly need to make sure that it's stronger in the future. And I guess we'll have to make sure that we listen, I suppose, carefully to our politicians, but I just genuinely wish that there was a better level of competence at government level of all political persuasions